Deborah Gorman-Smith, who's professor also at SSA and principal investigator and director of the Chicago Center for Youth Violence Prevention, is going to talk about neighborhoods in the context of youth development, and she's a national expert in that area.
Good morning. This actually worked out well, Rob. We didn't completely, I know Rob's work, and so I was hoping he was going to talk about what he did as a nice transition to me, and it worked out. I'm going to take just a second to give a little context for why I care about context. So I'm a clinical psychologist by training, and in the early part of my career, I spent a lot of time doing clinical work with kids and families, primarily those who were referred by courts or DCFS. I spent pretty much all of my time talking to kids about what it was like to be growing up in the neighborhoods they were growing up in, and particularly their exposure to community violence. And a lot of times working with parents who were doing all of the things that all of us in this room try to do with our kids, and we're still struggling. And this was about 20 years ago, and at the time there was this revitalization of research on neighborhoods, and so I became particularly interested in trying to understand how where you live matters in terms of kids' risk, but in particular how where you live matters in terms of what you need to do as a family and as a parent to help support healthy development in particularly difficult contexts. So I do research primarily focused on youth violence, and so I just throw this up here as just a context of the nature of the problem that we're trying to address. So for those of you who are not steeped in this work every day, as I am, just a note that homicide is the second leading cause of death for young people between the ages of 15 to 24. Almost in 2011, the most recent statistics we have, almost 5,000 young people were the victims of homicide, which is an average of 13 kids each day. This is largely a problem that men are most impacted by, but certainly there's a substantial minority of women who are also the victims of violence. The large majority are killed with a firearm. And importantly, it's not just those kids who actually die, but over 700,000 young people between the ages of 10 and 24 are treated in emergency departments for injuries sustained from physical assault. So it's a significant public health problem. And it has important implications for what it means if you're growing up in a neighborhood where this is all around you. We have a study that's funded by the Centers for Disease Control that we call Neighborhood Matters. Everything matters. We also have a study called Dating Matters, because things matter. So we're working in 30 Chicago neighborhoods with I don't have time to go into it, but the population, the poverty between 20 and 40% of the population below poverty, stratified, 15 primarily African American, 15 primarily Latino, because this is a very segregated city, has been said over and over again this morning. And these are just some numbers of kids between 5 and 8 years old and exposure to violence, just highlighting this number of almost 60% of kids talking about being afraid to go outside and play, living in their neighborhoods. By the time that kids reach adolescence, the large majority have been exposed to some type of violence. In our sample in these neighborhoods, 87%, and these are serious forms of violence, with lifetime rates of 18% having actually witnessed someone shot or killed, and 32% having a close friend or family member murdered. This is some work that we are doing in collaboration with Ceasefire, which is a public health approach to decreasing violence in Chicago, but now across the country and in other countries as well. And this is actually some work we were doing to see if we could, using neighborhood level informants, see if we could predict when there might be more serious violence outbreak happening within the neighborhood by having people in the neighborhood report kind of lower level kinds of things going on, like increased graffiti or violence on street corners or some fights. And I put this slide up here not to talk about that study, but really much more visually for you to think about looking in these neighborhoods, what it's like to be a kid living in this neighborhood. This is over a 6-month period of residents reporting, and these were corroborated by police reports as well. 6 months period, you can see that there is not a single place they can go in their neighborhood where they're not exposed to violence in some serious way. This is, just to put that in context, violent crime in Chicago, with the red areas being places where there are more than 400 violent crimes per square mile. So you can see that crime is not equally spread throughout the city, and if we overlaid our maps with Rob's, we would see quite a bit of convergence. Notably, those on the west and the south side, I was just talking to a group of kids recently, and I was actually showing some pictures that were not this, but similar to this. And not a single one of the kids that I was talking to had ever seen the lake, even though they lived about 2 miles from the lake. And that's not uncommon, but just another point when we're thinking about neighborhoods and really how localized, as we talk about these space, that these neighborhoods can feel for kids. So in my field, much of the neighborhood research has been based on sociological theory regarding risk for crime happening in a neighborhood. And what we're really interested in is how neighborhood context relates to individual risk and individual development. And as pointed out by the fact that we have this conference in my field, there are literally now hundreds and hundreds of studies looking at the relation of neighborhood characteristics and child and adolescent problem behavior. And basically what we know is that it's really bad in a lot of different ways for kids to live in poor, high-crime neighborhoods. So it'd be better for them to live somewhere else. But some of the key findings that we have from our from a couple of our developmental studies following kids and families over time, not necessarily rocket science, but I think sometimes does get lost in the conversation, that family is critical for risk protection and promotion of healthy development. And when we talk about family, we're talking about parenting, the kinds of things that we discipline and monitoring, but it's not just about knowing where your kids are, knowing who your kids' friends are, but these other aspects of family relationship characteristics, particularly warmth and cohesion and a sense of support and connection to one another, are particularly important. And we find in our studies looking longitudinally that for kids who live in families, particularly in the context that we're talking about, where even if parents are doing all this discipline and monitoring well, without those other aspects of family relationship, they tend to be at increased risk for getting involved in more violent kinds of behavior. But it's not just the family. We know that neighborhood matters, both the structure of the neighborhood, and as Rob talked about, and I'll talk just a little about, the social processes are also important. But most important really for what we're beginning to start to tease apart is the interaction between family and neighborhood. That there are direct effects of living in these neighborhoods on kids' behavior, and there are direct effects of what you receive from your family, but there are differences in how parenting behaviors relate to the outcomes depending on when you're living. So doing the exact same thing in one neighborhood may not have the same effect on your kid's outcome as it does in another neighborhood. And in fact, you have to be an even better parent in the context where you have much less support to be that good parent. So we talk about community structural characteristics that really largely reflect the economic conditions of the community. And I have an asterisk next to crime because for us, the amount of crime and violence in a neighborhood is also very important. Again, this is one of those instances where a lot of the research has had crime on the right side of the equation, and for me, crime is on the left side of the equation, for those that makes any sense to. But also, as Rob said, it is important are what's happening socially within the neighborhood, the social processes. Early in this work, the assumption was that these two things were essentially interchangeable, so that neighborhoods that were characterized by poor economic conditions, high rates of poverty and mobility had essentially low neighborhood social organization. So you could essentially use concentrated disadvantage, for example, as a proxy for what was happening in a neighborhood socially. Our data and the data from others has shown that, in fact, that's not necessarily the case. So this is just a correlation between concentrated poverty and neighborhood social organization from one of our studies. And what you see here is that they're related, but this is about a 0.3, yikes, 5 minutes, 0.3 correlation. So they're not the same. It is the case that there are neighborhoods that look very similar in terms of these structural characteristics, but function very differently in terms of these neighborhood social processes. And what is it that happens within a neighborhood that allows that to happen? I did some work with Liz Plater-Zyberg and some of her colleagues in Miami a number of years ago that I don't have time to talk about, but shows that some of that actually is about, in fact, about the built environment, particularly walkability and eyes on the street. So being in a poor neighborhood doesn't necessarily mean that you can't build that kind of same neighborhood social organization. Given that I'm out of time, I'm gonna skip through a couple slides. One of the struggles that I had early on in starting to do this work and think about it was the assumption that really this is about poor functioning families living in these neighborhoods. It's really about the people that live in the neighborhoods. Completely that's related to the crime. And so this is just a table. These are 3 different types of neighborhoods, all poor neighborhoods with and without functioning social processes, looking at family functioning over time. And I put this up here really just to make the point that it's not the case that the worst functioning families are concentrated in the worst neighborhoods, that we really have this distribution of family functioning across neighborhoods. And what we really need to be doing is helping to support families. So what has all of this research that we're doing, how do we think then about what we might do to help support kids and families as they're growing up in these contexts? So I'm waiting for social and economic equality, but in the meanwhile, really starting to think about two things. So for the most part, our work is focused on the first, considering the context, but not necessarily working to change the context, really doing social interventions with individuals and families to manage living within the context that they're in, versus the work is similar to what Rob just talked about, how do we change the social context. So we have been doing, over the last 20 years, a lot of work to promote healthy development and family capability in high-risk communities, developing family-focused interventions that build protection through these things. But a key component of what we're trying to do in working with families is we work with families in multiple groups to help to bring families together. As Rob mentioned earlier, one of the things that we've found from our work and others find consistently is that families who live in these contexts are often really isolated from one another, even though they're living very close to one another. That for lots of reasons that tend to be about trying to protect their children and keep them safe, they tend not to spend a lot of time together, but what that does is leave them not having good information, without access to social support around just really, frankly, how hard it is to be a parent. So we bring people together hoping to build this social connection and support, and our data seems to suggest that not only do people who are involved in these groups, do they start to use one another for support, but then they start to, there's an ecological and a spillover effect where that starts to branch out over time. This is I feel like I'm doing like the marathon, quick 20 years of research. A quick slide to show that we have significant effects by working with families in these contexts. Even when we're working with kids and families as young as first grade, we see large reductions in school reports of serious misconduct and reports of violence, and also a significant increase in being on track for high school graduation. When I was telling a colleague that I was going to do this, be at this neighborhood conference, he said, "Are you going to talk about your center findings?" And I said, "No, it's a neighborhood conference." And he said, "Well, but your center work is focused on a neighborhood." So in the last minute I have, I'm just going to talk a little bit about the work that we're doing through the Chicago Center for Youth Violence Prevention, which is funded by the Centers for Disease Control and Prevention. So we're working in Humboldt Park. Quickly, for those of you who don't know anything about Humboldt Park, it's a neighborhood that when we started had violent crime more than twice the average rate in Chicago, and shooting and homicides 3 times higher. It was one of the few neighborhoods that had any kind of ethnic diversity. It's fairly poor. But we started working in Humboldt Park because there were a number of things already going on in the neighborhood that were focused on youth development and prevention of particularly youth crime and violence. So we went in with the idea of trying to capitalize on the existing structures and build from those. schools, to work with community agencies to evaluate what they were doing, to bring evidence-based programs into the community, and then also to bring additional programs into the community that weren't already there. So just quickly, in addition to the work that was already being done in Humboldt Park, the center has funded an increase in the work of ceasefire in the community, with a particular focus on the ceasefire activities that are focused on changing community norms and mobilizing and engaging neighborhood residents to change norms and attitudes around crime and violence, but also then beginning to work with high-risk kids and families in all of the Chicago public schools in the neighborhood. And 3 years later, we started this work in 2010. Our early results are showing significant reductions in homicide between 2010 and 2013. We saw a 50% decrease in homicide in our community during a period of time when the murder rate in the other violent communities and Chicago as a whole has changed relatively little. And then looking at violent crime overall, doing a number of some propensity score matching and using a regression discontinuity design, we see significant reductions in violence that is consistent across a number of analyses that we've done, even compared to all other neighborhoods in Chicago, compared to all other neighborhoods where ceasefire is present. And our hope is that as time goes on and we can have this multiplier effect, that we'll see even greater reductions going forward. And I'll stop there. Thanks.